here in Jeddah, Saudi Arabia, in Ibn Sina National Medical College. And with me, I have Riham. Oh, the sound is not good enough. Can you hear me better now? Is it clear for everyone? Is my voice clear? All right, okay. Yes, okay. Alhamdulillah. All right, so my name is Sherehan. I'm a final year medical student here in Jeddah, in Ibn Sina National Medical College. And with me, I have Riham, who's a 5th year medical student, also in my college. And we are supervised by Dr. Helen, who is a clinical anatomist, also in our college. I'd like to specially mention that we have a clinical pathologist with us, Dr. Suban. He will be able to answer your questions, inshallah, towards the end of the program, along with Dr. Helen. So we hope that you stay with us until the end of the program, inshallah. All right, so we're all here together today to become more aware and to gain knowledge on breast cancer and its screening methods. All right. So what is breast cancer and why is it such a big problem? I want this to be an interactive program. So can the ladies from the audience, can you please tell me in the chat box, what do you think cancer is? And why is it such a big problem? Give us your ideas. Anyone? Let us know what you think on the chat box. Anything. We're all here to learn. What do you think breast cancer is and why is it a big problem? I can't see any messages. All right, okay, we'll go straight to the topic then. Uncontrolled growth of cells. Okay, I can see that the doctor, mashallah. Okay, anyone else? It's the formation of lumps in the breast. Yes, okay, good. One of the most common cancers in females worldwide. Yes, mashallah. Mashallah, we have, everyone is somewhat aware, mashallah. That's brilliant. Okay. So, what is cancer? Now, we all know that our body normally grows. This is normal. This is expected. Yes? If we have a cut in our hand, in a few days, our skin is going to grow and it's going to heal. This is normal. And we all know that our body is made up of cells. Yes? I hope everyone knows this. But what is cancer? Cancer is when these cells grow uncontrollably, when they grow abnormally. This is cancer. And if these cells grow in the breast, that's when you call it breast cancer. So why is it such a big problem? Why is breast cancer such a big problem? It's because these cells, they suck the energy and the life out of you. They grow so vigorously that they drain you from your energy. That's why people with cancer are tired and they get weak. Okay, so can you tell me, the audience, are all breast tumors, are all breast lumps considered breast cancer? Can you tell me on the chat box? No, yes, exactly. Not all breast tumors are considered breast cancer. There are 2 types. They can be either benign or malignant. Now, I don't want to use too many scientific terms, but this is the basic, just for you to understand. Benign is a non-cancerous tumor. It is not cancer. It is a tumor in the breast, yes, but it is not as bad as cancer. Malignant breast tumors are cancerous. This is the more scary, the more troublesome disease. That's breast cancer. All right, so there are 2 types. And alhamdulillah, it is a mercy of Allah that 80% of breast tumors are benign and only 20% are malignant. SubhanAllah, this is a mercy from our Rabb. Okay. So why have we chosen to speak about breast cancer today? Why couldn't we speak about anything else? We could have spoken about stomach cancer, we could have spoken about ovarian cancer, because breast cancer is the most common cancer in the world. It is the most common cancer as well, and it is the 2nd most common cause of death among cancer-related deaths. So this is how much of a big problem breast cancer is, and this is why we are speaking about it today. So what is your first step that you could take towards being aware and towards being knowledgeable? You should know your risks. To talk about your risks, to know about more of the risks, We have Dr. Helen with us. Dr. Helen.
Hello, everyone. I hope you're enjoying today's session. I hope I'm clear. Can you just type? Can you hear me? Yes, thank you. So, all of you can categorize yourself into two groups, the ones who are above 40 and the ones who are less than 40, okay? So I will concentrate on the ones who are above 40 because they are under high risk, okay? If you are old and you're more than 40, you come under high risk. If you have a high exposure to estrogen, you are under high risk. So high exposure to estrogen means that you got your first periods before the age of 12. You got married old and you have no or very few children. You did not breastfeed your kids and you have taken hormonal therapy, that is also in short it's called HRT or oral contraceptives, and you have reached menopause after the age of 55. Okay, I would like to tell you more about estrogen. I hope many of you already know that estrogen and progesterone are the hormones related to the female, and in a menstrual cycle there will be either an increase or decrease according to the different phases of the menstrual cycle. There is increase of estrogen or there's a decrease of estrogen. So a woman undergoes so many changes with the estrogen throughout her lifetime. Now, if a woman gets pregnant, her estrogen level is low. And if she breastfeeds for 2 years, again, her estrogen is low. So for example, if I have one child and I'm pregnant with it for 1 year, so my estrogen level is low, plus 2 years of lactation. So there's totally 3 years I am safe, or the estrogen level is quite less. Now, if I have 2 children or if I have 3, it just keeps multiplying over and over. So if I have 2, it is 6 years of reduced level of estrogen. That's why we say that if you have more children, the estrogen exposure is less and it is more protective for a woman. Okay, and now when you say that you have first period before 12, that means you have again more exposure. And if you have menopause after 55, that means again you have more exposure to estrogen. Okay, I have relatives who have breast cancer. Again, I'm at high risk. I am obese and I eat fatty food. Okay, I am less active. I have alcohol or tobacco or drugs. I think most of us will not be having this. We will be leading the proper lifestyle. I have had breast problems. So all this puts you at high risk. Now, if you would look into them, most of them are modifiable. That is, you can make some changes in your lifestyle and you can correct yourself. But some of them are immodifiable, so that you cannot make, it's not under your control. Okay, for example, getting your periods before 12, or reaching menopause after 55, okay, or having breast cancer relatives. This is not in your control. So these are non-modifiable risk factors. But the modifiable risk factors, yes, they can be changed. And if you look at the low risk, alhamdulillah, they are all on the other side. But that doesn't mean that you have low risk, but again you need to screen yourself and you need to take care of yourself. The people at high risk should do it more often. Okay, I hope this slide is clear. Next. Now, how to reduce the risk? So you need to lead a healthy lifestyle. You can lead it according to the prophetic lifestyle, what our Prophet ﷺ has told us. You need to reduce your sources of stress. It has been seen among the research studies that women who work are more exposed to stress and they have more higher chances of getting breast cancer. Okay, so you need to sleep well. So we know that we should sleep at Isha, soon after Isha, and get up in the morning, pray a tahajjud, and take the barakah of the morning hours. So this is the right time to sleep. And there is also a gland in our body, it's called the pineal gland, which also functions very well, and it helps in building your immunity. Okay, so sleep well, exercise, try to keep a good health and weight, maintain your weight, eat well, eat lots of vegetables and fruits. Okay, take at least 2 to 5 servings per week. Keep away from smoke and intoxicants. Breastfeed your children. So according to the Sunnah, it's best to do it for 2 years. Even the WHO recommends breastfeeding, exclusive breastfeeding for 5 months, and then continuing it for 2 years. And make use of all the blessings of the prophetic medicine, like the black cumin seeds, which is called habas sauda, then the ajwa dates, the zamzam water. Okay, you must have heard there are many, many beautiful stories of women who are tested positive with breast cancer. They come down for umrah, for hajj, they make lots of dua, they take zamzam water, and when they go back and they have tested themselves, they have even come negative. Okay, so please don't forget the tawakkul on Allah. But this doesn't mean that you just concentrate on this and leave out the medical aspect of it. You should go for treatment with proper tawakkul on Allah. Next. Reduce your risk. Now, what more you should do? Sherehan will continue.
Okay, thank you, Dr. Helen. All right, so you've reduced your risks. What more can you do? My dear sisters, this is the most important part of this program. So I want you all to pay attention, to look at your screens, and to concentrate. Screening. Screening is the most important part of this program. All right, so I want everyone to have your full attention and concentration now. Screening is the only way you can fight breast cancer before it even starts. So, what is screening exactly? What is screening? Screening is nothing but finding out if there's anything abnormal or there's an unusual change in your breast without having any symptoms. You don't have to have any symptoms. You're just going to see if there's anything abnormal or anything unusual. So what are the 3 types of screening? We have the breast self-examination, BSE, the clinical breast exam, CBE, and mammography. BSE is the screening that you will do on yourself. A clinical examination is done by a health provider. This could be a doctor or a trained nurse, done in your primary healthcare center or in a hospital. Mammography is something that a machine would detect in your breast. So basically, breast self-examination is done by you, clinical breast exam is done by a health professional, and a mammography is done by a machine. So I just want you to remember these 3 terms so that it'll help in further explanation. I will tell you what it is later on, inshallah. Okay, so when and how do I have to do the screening? We're going to divide the women into 3 age groups. I think most of the women here today with us are over the age of 20, but I did see, mashallah, I did see some younger girls under the age of 20 participating, and it's really, really nice. I really want to appreciate them. I mean, if they are here, they could say hi in the chat. We'd like to see them. It's really good that the younger generation is very eager to learn things like this. It's really very promising. All right, so when and how? We're going to divide the women into 3 age groups. One above 20s, the other between 30s to 40s, and the last over 40s. So what do you have to do when you reach the age of 20? From 20 years onwards, you have to do your breast self-examination every month. This is a given. The minute you reach your 20 years of age, you have to do the breast self-examination every month. This is very important, my dear sisters. And how about the clinical breast examination? The examination that the health provider would do for you. This you can do every 3 years. So your first clinical breast examination you can have at the age of 20, followed by 23 and 26, and so on until you're 30. What about after you're 30? Breast self-examination, again, monthly. And clinical breast examination every year. Okay? How about when you're 40 and over? The same thing like when you were 30. You'll have to do your breast self-examination monthly. This is a given. You always have to do it monthly. And your clinical breast examination annually, but on top of the clinical breast examination, you'll also have to have a mammogram every year. And this is a recommendation of the American College of Radiology. So this is what we all have to do at the age of 20, from the age of 20 onwards, we have to do a breast self-examination monthly. And we have to do a clinical breast examination every 3 years until you're 30. Continue with the breast self-examination monthly. The clinical breast examination has to be done every year. And after you're 40, you have to do a mammogram in addition to your clinical breast exam. Okay. So I'm keep using this word breast self-exam, breast self-exam. How do you do a breast self-exam? Okay, I will tell you now. And again, ladies, please concentrate on the screens because we're going to use pictures to describe how to do it. I apologize, I know some of you might feel uncomfortable, but in this, the use of pictures is only to gain knowledge and to become more aware. Okay, so step 1 of breast self-exam, look. You just have to look at your breasts. So in the privacy of your room or your bathroom, you'll have to look in front of the mirror, take off your top, and you'll have to look at your breasts. How are you going to look at them? You're going to look at them in 3 poses. The first pose, with your hands down on either sides. The second, with your hands behind your head or above your head. And the third, with your hands on your hips. The first pose, I'll repeat this again. You just have to look in the mirror, look at your breasts with your hands down. And number 2, your hands behind your head. And number 3, hands on your hips. As simple as that. This is the first step of breast self-examination. So I'm telling you to look. What do you have to look for? This is a lovely illustration. As you can see, the lemons are, you could consider them as breasts. So what are you looking for? First thing, you're looking for a thick area. So you have to look for a thick area on your breast. Or you're looking for a dimple, nipple crust. What do you mean by nipple crust? It means a nipple rash or extreme nipple dryness. You're looking for a red or a warm breast, a hot breast. You're looking for any unexpected discharge. So that could be like blood or a very thick, sticky fluid. But if you're breastfeeding, obviously, milk is something that is expected and it is something that is normal. You're looking for skin sores. So skin sores are something like you could say wounds, wounds on the skin. You're looking for a bump on the breast, for a growing vein on the breast, for a nipple that is sunken or that is retracted, a different shape or size of the breast, or you could look at the skin of the breast to see if it looks like that of an orange. So we all know how an orange looks like. It has many pores on its skin. So you're going to see if the breast looks like the skin of an orange. So all of these are the changes you're going to look for. Now, many of you might have not done the breast examination before this. So, inshallah, I want all of you, sisters, all of you, after you learn how to do it, please begin doing it from this month. And the first month, look at your breasts, become aware of your own body. You need to know the norms of your body. You need to know your body, okay? So look at your breasts, understand what is normal for you, and from the next month onwards, look for these changes. Anyone, some of you might be familiar with these terms because these were mentioned in the survey that we sent on the group for the program. And there is a survey after the program as well. So I kindly request all sisters to attempt it. It'll be much shorter. I know the first one was quite long. Second one after the program will be much short, but it's very good to enhance your knowledge about it, to retain the information about it. And inshallah, it will be of great benefit to us as well, inshallah. The last one was a hard lump, if you can see the last lemon. So a hard lump, you obviously can't see it. So you can't do it in step 1, but you can do it in step 2. So step 1 was to look. I'll just revise it quickly. You have to look at your breasts in the mirror with your hands on either sides, with your hands behind your head or above your head, and your hands on your hips. Step 2, you have to feel, okay? So you have to feel your breasts in either any one of these 3 patterns. You have a circular pattern, you have an up and down pattern, and you have the wedge pattern. You can choose whichever one that is convenient for you. So how are you going to feel your breasts? You're going to use the pad of your fingers, not your nails. If you use your nails, it's obviously going to hurt you. So you're going to use the pad of your fingers, the palm of your fingers, and start from the outer corner of your breast. And if you're talking about the circular motion, the circular pattern, I'll try to use spotlight for you. I hope everyone can see. So if you're talking about, if you want to do the circular pattern, you're going to start from the outer corner of your breast and go around the breast in the biggest circle possible, covering the maximum area of the breast. As long, you need to cover the whole breast. You shouldn't leave a square millimeter, all right? So we're going to start from the outermost perimeter of the breast, the outermost circumference, make a big circle, and then a smaller circle, and then another small circle, and keep going on until you reach the nipple. And you should also feel around the nipple as well, underneath the nipple and everywhere. Basically, your whole breast has to be covered. This is the most important thing of the breast self-examination in step 2. You have to cover your whole breast. And you should use enough pressure that you can feel through all the tissues, all right? Not so hard that you hurt yourself, but you should be able to feel through all the tissues. And how about the up and down pattern? It's simple, again. Start from the outermost corner of your breast and go down and up and down and up. As long as you cover the whole of the breast, it's good. And then you have the wedge pattern. You start from the outermost corner of your breast, again, go towards the nipple, go back out, come back towards the nipple, and you just need to cover the whole breast again. And you can choose any pattern you want, doesn't matter. All right, so you have to feel your breast. Remember, we have 2 breasts, so you have to do it on both left and the right side. And you should not forget the armpits as well. You should also feel for any swellings or any lumps in the armpit. Now, a lot of you might be wondering, why the armpit? How is it related to breast cancer? I'll show you a little bit of the anatomy so you understand. Okay, so if you can see here, this is the breast. And here we have tissue of the breast. It's fatty tissue. And this dark pink structure is what you call lobules. These dark pink structures are lobules, and they are connected to what you call ducts. So the lobules, they basically function to produce mother's milk, and the ducts carry this mother's milk towards the nipple. All of these are cells of the breast, and cancer can arise from any one of these cells. La qadrallah, if cancer does arise in any one of these cells, it can also spread to what you call lymph nodes. If you look at this image here, there's a lot of lymph nodes here in the armpit region. This is the reason why we tell you to feel the armpit as well. Because lymph nodes, not many of us know what the lymph nodes are. They're very much like blood vessels, except they are used to filter any toxic substances in our body. SubhanAllah, the beauty of nature. So they're also connected to the rest of the body. So you can see that if the cancer spreads to the lymph nodes, it can also spread to the rest of the body. So my dear sisters, the bottom line is you have to make sure that you palpate, you feel the breast and the armpit region as well, because they are equally important, okay? All right, so step 3, you have to squeeze. In step 1, if you remember, you were told to observe for any discharge. In step 3, you have to squeeze the nipple to see if there is any discharge. So I'll just quickly revise it once more again from the beginning. Step 1, you have to look. And in how many positions have you to look? In how many poses have you to look? You have to look with your hands on either sides. You have to look with your hands on your head. You have to look with your hands on your hips. Step 2, you have to feel your breasts. How are you going to feel them? You're going to feel them in any three different patterns, which are the circular pattern, the up and down pattern, and the wedge pattern. And do not forget to feel the armpits as well. Step 3 is to squeeze the nipple. I'm hoping it's very simple, inshallah. I don't think it's too complex. But we haven't come to the end of BSE yet. We have the last step, repeat steps 2 and 3 while lying down. Simple as that. So what was step 2? We had to feel the breast and the armpit. And step 3 was to squeeze the nipple. So you're just going to repeat these 2 steps while lying down. Why while lying down? Because when you lie down, your breast becomes flat on your chest and it's easier to feel for any masses, okay? So how are you going to do this? You're going to lay behind on your back. And if you're going to examine the left breast, like shown on this picture, you're going to raise your left arm up and you're going to raise it above your head and you're going to examine your left breast with your right hand. And if you're going to examine your right breast, you're going to have to raise your right hand above your head and examine it with your left hand. So this is the whole of breast self-examination. I'll go through it one last time. You'll have to look in the mirror at your breasts with your hands on either sides, with your hands on behind your head or above your head, with your hands on your head. 1. Step 2, you have to feel your breasts and your armpits in either a circular pattern, in an up and down pattern, or in a wedge pattern. Step 3, you have to squeeze the nipples to see for any discharge. Step 4, you have to feel your breasts while lying down. So this is all, it's very simple, and it can also be done in the shower. A lot of women do it in the shower with soapy skin, and they have said that they're able to feel the tissue better. This is your choice, whatever you prefer. Simply do not forget to do it every month. My dear sisters, so we've learned the 4 steps of breast self-examination. I hope it is clear for everyone. It is very simple and very straightforward. Do not forget to do it every month after the age of 20. So choose an appropriate date every month, maybe on your birthday, on your wedding anniversary, or preferably 5 to 7 days after your period. Do it every month. This is the most important thing, and it's a very simple thing, which will save you from many, many great consequences. Okay, so I told you about breast self-examination. Now we have the clinical breast exam. A clinical breast exam is similar to a breast self-examination, but it's only going to be done by an expert. So you just have to go to the primary healthcare center or to a hospital and you have to request for this exam to be done. It would be done by a trained nurse or a doctor. And a mammogram. What is a mammogram? So a mammogram, like I said, is something, it's a screening method that the machine will do on you. What is a mammogram? It is nothing but an X-ray. I'm sure everyone knows what an X-ray is. It's an X-ray meant for your breasts, that's all. How is it done? Your breast will be squeezed between 2 plates, horizontally and diagonally. I know a lot of you might be fearing the pain in this, but the pain, it really depends on your level of pain tolerance, and many women don't feel the pain as well. So this few seconds of pain, my dear sisters, will save you from a much greater consequence than you leaving this to detect it later and having a mammogram later. You'd rather have, if you're more than the age of 40, you'd rather have this few seconds of pain just once every year than face great consequence. So a mammogram is nothing but an X-ray, and you can do it while breastfeeding, but I'm pretty sure most women know that you cannot have X-rays while you are pregnant. So you also cannot have a mammogram while you are pregnant. Avoid using any sort of deodorants or antiperspirants before the procedure. Why? Because these can leave a shadow on your X-ray and it could interfere with the results of the X-ray. All right? Okay, so I hope it's clear what a BSC, what a CBE, and what a mammogram are. So what happens if I find a lump? Do not let the fear of finding a lump stop you from doing breast self-examination. My dear sisters, this is one of the main goals of our program today. We did this program, I need to mention that we did this program in Arabic as well before this. And when we are asking sisters to join the program, a lot of them refused just by hearing the word breast cancer. This is a type of attitude we need to stop. Never let your fear lead to ignorance. You need to face your fears. Yes, everyone is scared of this word breast cancer, yes, but you need to face it. Not let your fear stop you from doing a breast self-examination. Okay? So, and remember, one of the mercies of Allah, even if you find a lump, 80% of them are benign. Only 20% are cancerous. All right, so what do you do if you find a lump? Don't panic, but go to your doctor. See your doctor as soon as possible. If the doctor doesn't consider the slump, go for a second opinion. No harm, go for a second opinion. And this doctor should, the typical procedure is that they would ask you to have a mammogram, an ultrasound, or an MRI. And if they find a lump, they will ask you to do an FNAC or a biopsy. What is an FNAC and biopsy? Basically, these are just procedures to take the cells from the lump or the tumor to see if they are cancerous or not. And if it was cancerous, based on the staging, you will be given a treatment that is catered for you. So we have chemotherapy, hormone therapy, radiotherapy, targeted therapy, or surgery. I don't want to go in depth to these technicalities. Then these are treatments just available for breast cancer. But our main goal here is to be able to detect breast cancer early by screening, okay? So why do I need all of this? Why is it necessary? Why do we have to do a breast self-examination? Why do we have to do a mammogram? Why do we have to do a clinical breast exam? My dear sisters, even if you are of low risk, remember our responsibility towards our body. Allah has blessed us with such a beautiful body, and it is our responsibility to take care of this body. Breast self-examination is a very small thing. It's something when you get used to it, inshallah, it would take maybe 5 minutes. So this 5 minutes of your time can save you from such a big disaster. This is the reason why this is all very important. And we need to all understand our responsibility towards this body that Allah has blessed us with. Leave alone this, it's not going to happen to me attitude. We all think sometimes that maybe this won't happen to me, but subhanAllah, it could. We never know. Yes, tawakkal Allah. If it was written in your qadr, it will happen, yes. But we can reduce the consequences. We can have preventative measures. This is why I said screening is so important. Here we've stated the words of a breast cancer surgeon. She's been seeing breast cancer patients for so long, but she neglected herself while taking care of these breast cancer patients, subhanAllah. And she herself suffered from very severe breast cancer. So never think that it's not going to happen to me. We all have a risk. But there is, alhamdulillah, with the advance of medicine, there are ways we can take care of ourselves and prevent any big consequences. Okay. So, like I said before, early detection saves lives. If you detect breast tumor when it's at stage 0, your survival rate is close to 100%. If you detect it at stage 4, the survival rate is close to 20%. So you can see the huge difference and the huge difference screening would make. Okay. So to clarify a few misconceptions commonly around breast cancer, we have Riham.
Assalamu alaikum.
Wa alaikum assalam. Yes, Riham.
Yeah, here is Riham. I will try to clarify, inshallah, the most common misconception about the breast cancer. By the way, this part of the presentation will require your contribution. For the point I am going to highlight with a simple answer, yes or no. Well, let's start. Is my voice is clear to you? Yes or no? Okay, good. Thank you. Thank you. Okay. Number 1, breast cancer isn't very common, is it? Yeah. Right in the chat box, can I see? So I can't see. Yeah, Fatima. Good, good. Yeah, mashallah. All of you, it's the right answer. As Sherehan said at the beginning, breast cancer affects 1 in 8 women. And this is percentage. So breast cancer is a common serious disease. Number 2, there is nothing we can do to reduce the risk of the breast cancer. Is there? Tell me, what do you think about this conception? Is it right or wrong? Yeah, Hannah, thank you. Dina, thank you all. Yes. Yes, sure. There is a modifiable risk. We can change it, as Dr. Helen just explained. Like reduce eating fatty food, being healthy, do some exercises, and of course, breastfeed your children. All of this will have positive effect in your life and will decrease the chance of getting breast cancer. Next, do you think the breast cancer is a hereditary disease? Means, do you need to have a family member with the breast cancer to have it? Am I right or? Yeah, thank you, Sarah. Welcome again, yeah. Yeah, someone? Yeah, it's possible, but it's absolutely not. It's not hereditary because women who has a family history of breast cancer are in higher risk group. Most women who have breast cancer have no family history. Statistically, only about 10% of individuals diagnosed with a breast cancer have a family history of this disease. Unfortunately, all of us under the risk. Do your duty as a woman. Take the necessary precautions by doing breast self-examination and do the mammogram. Yeah. Then mammogram can never miss a cancer, can they? Yeah. Share me your thought, please. Yeah. And Shirah, thank you. Yeah, it can. Yes, yes. Thank you all. Mammogram can detect. Right, some cancers are detectable by the physical examination, might not be seen by the mammogram. There are very, very small tumors which cannot be detected by mammogram. So we need further investigation to detect it. Okay? Next misconception is abnormal mammogram mean I have a cancer. Tell me, what do you think? Yeah, Rashida, right. Okay. Oh, yes. Thank you. Thank you. Really appreciate it. Repeat the question. Okay. Abnormal mammogram mean I have a cancer. Okay, Faiza, do you hear it? What do you think? Okay, let's see. As I said, mammogram cannot detect every single tumor. Okay. At the same time, not every tumor mammogram detected mean it's cancer. Some of them are benign tumor. As Sherehan said, benign is not a cancer. It has only a mass effect that lacks the ability to either invade the neighboring tissue or spread throughout the body. It's a non-cancerous growth. It's just the mass. Okay. So after you get mammogram result, don't get panic. Still, there are a followed procedure like biopsy and blood test. We have to do it to confirm is it cancer or not. Okay. Can I detect a cancer before mammogram can detect it? Okay. Okay. Why? All of us think. Yeah, this is the misconception here. We are here to clarify. Okay. No, mammogram cannot detect breast cancer earlier. Mammogram can detect the breast cancer earlier than we can do. So please, if you are above the 40 years, يعني be stick to doing a mammogram annually, because mammogram, you should do it. Okay. طيب. Then mammogram can cause the cancer and the spread of the already existing cancer. What do you think? Mammogram can cause the cancer? Okay, no. Fatima said yes. No. Yeah. No way. Mammogram will not. Mammogram is an X-ray of your breast, and it's the best way to detect the breast cancer. Mammograms require a small dose of radiation. The risk of harm from this exposure is extremely low. The benefit always outweighs the risk. So go ahead and schedule your mammogram as soon as possible. Okay. Next misconception: do having big breast increase the risk of getting breast cancer? MashaAllah, yes, all of you are right. Okay, very small breasts and very large breasts are not at risk of getting breast cancer. Till now, there is no evidence to show that women with large breasts are more likely to develop breast cancer. So there is no relationship between the size of the breast and the breast cancer. Okay. Well, next point is deodorants and antiperspirant like Dove and Nivea, especially which contains aluminum mineral, will cause breast cancer. Okay, what do you think about the deodorant? Can it cause breast cancer or not? Okay. Actually, there is no known link between the antiperspirant or deodorant and breast cancer. Yani, like I said, like a breast cancer, like the size of the breast cancer, no relationship and between the breast cancer. The same with the deodorant. There is no relationship between the deodorants and the breast cancer. Just take a precaution when you are going to do a mammogram. It's better to avoid it, so it will not interfere with the mammogram results. Okay. Okay. Cell phone increase the risk of the breast cancer. Okay, tell me what do you think about this? What do you think about the cell phone? Can it cause breast cancer? Okay. You can relax a bit because studies have found no increase in the risk of the breast cancer or other type of cancer from the cell phone use. So it's safe to use it. Not safe, but it will not cause breast cancer. Okay. Next, does wearing wired bras cause breast cancer? Yeah. The theory was that wearing a bra, especially an underwire style, could restrict the flow of lymph fluid out of the breast. causing toxic substance to build up in the tissue. However, there is no evidence to support this scenario. So, bras will not cause breast cancer. Okay. Last misconception is that men don't get breast cancer. Do they? Yes, no, thank you. Yeah, thank you. Sarah, thank you all. Really appreciate it. Men may not think of themselves as having breasts. For men, it's their chest or their pecs. But the fact is, men have breast tissue. So, men also can get breast cancer. Each year, it's estimated that approximately 2,190 men will be diagnosed with breast cancer and 410 will die. While this percentage is still small, men should also check themselves periodically by doing breast self-examination while showering and report any changes to their physicians. Okay, this was my part. Thank you all for listening. I really appreciate your valuable contribution. May Allah bless you all. Thank you.
Okay, thank you, Riham. All right, so I can say the chat that a lot of women were confused, a lot of girls were confused about the part where when can a mammogram and when can we detect a tumor in our breasts. The thing is, a small tumor will be easily detected by a mammogram than by self-breast examination most of the time. So that's why we say a mammogram can detect a smaller tumor before the woman herself, okay? But then I understand the confusion where some of you think, then why did you say that mammogram cannot detect all tumors? The reason why a mammogram cannot detect all tumors, one of the reasons is because some women naturally have dense breast tissue. This is the reason we are asking all women after the age of 40 to go for a mammogram and to understand their normal body, to be aware of their normal body. Some women naturally have dense breasts. So dense breasts in a mammogram appear more white. And even tumors, breast tumors appear white. So what happens is these tumors aren't easily detected on a mammogram. This is why we say the mammogram sometimes may not detect a tumor, especially in women with dense breasts. So this is why you have to go and have a mammogram and understand your body, the norms of your body. You should be aware of your body so that you can be more precautious. So I hope this is clear. And here we have a book called Know Your Breast, a personal guide by Dr. Suban and Dr. Helen, who are both with us here today. And they will also be taking your questions today. So if any one of you, this video is being recorded and might be posted on YouTube. So if any one of you are willing to speak up and ask your questions, you can raise your hand and we can unmute you. Or you can just type your questions in the chat box, inshallah, and we can answer them if time permits, inshallah.
Okay, assalamu alaikum. I'm answering a question which was directed to me.
Yes, doctor, go on.
I'm answering this question which was directed to me. Okay, doesn't the mammogram expose you to harmful rays? Is it fine doing every year for women above 40 years? Okay, I hope sister who had asked me has got the answer. The mammogram, during the mammogram, the radiation exposure is very, very less when you would actually compare it to an x-ray, a chest x-ray. Okay, so the risk of being exposed to the mammogram every year is quite less when you compare to actually identifying breast cancer. Okay, so if you would weigh the benefits, it's better that you go for a mammogram and identify the lump or the tumor at a very, very early stage, and get yourself treated. Okay, one message I want to tell everyone is actually from our past experience for past like 10 to 15 years, we have noticed that the Muslim women usually they come to the clinics at a very late stage, at stage 3 and stage 4 for diagnosis and for treatment. Okay, so this is the reason we are trying to bring this awareness. We want you to be aware of yourself and try to go to the doctor as early as possible so that you have a better chances of survival. Okay. um, okay, I will direct this question to Dr. Suban. Does pain or aches on your breast help identify if we have breast cancer?
Assalamu alaikum, thanks, Dr. Helen, for this opportunity. I think before answering this, I want to congratulate Sherehan and Riham for doing this amazing job. So, to answer the question whether the pain and aches are related to breast cancer, majority of the breast cancer are painless. Okay, so when you have painful mass and depends upon various age group, mostly it will be of other pathology rather than the tumorous conditions. It all depends upon the age group and other clinical signs and symptoms. So one thing I want to give us a based on evidences, majority of the lump or painful lump or painless lump in the breast, majority of the lumps, okay, what females sense, it's all non-cancerous. Okay, in other words, almost nearly 99% of the lumps are non-cancerous. But why we recommend them to go for screening, as Sherehan and Riham said, it is the most commonest cancer. If you take any country's data, 30%, nearly 25 to 30% of the cancer in women is of breast. And it is it's like there are difference of opinions with respect to preventable or not preventable, but definitely it is yearly diagnosable. Definitely it is yearly diagnosable. That's why in United States no woman is dying of breast cancer because of the success in the cancer awareness and screening. And if you take Indian context, okay, nearly 50% of the cancer coming in women, either it will be of breast or cervix. So if you put together, almost 50% of the cancer coming in women are early diagnosable as well as preventable. So the rest of the 50% happens due to other reasons. But unfortunately, Muslim women are affected more, even cervical cancer in certain parts of the India. So it's very important to have this kind of program. So I think this answers the question regarding the pain and aches of the swelling. But I want to add certain things regarding the mammogram. Even rightly Sherehan said regarding the dense breast and the soft breast. The most important thing is most of the cancers are detectable in mammogram. That's very important. That is the key thing. In that case, not to miss the tumor in mammogram, that's why we do mammosonogram. Okay, most of the hospitals we try to do in the cancer screening, not only mammogram, especially in India. No one will send you just by doing mammogram. Okay, once you come for breast cancer screening, they will do ultrasonogram of breast. Both they will do. When you combine both the technique, I want to give this awareness specifically to all the participants here. So when you go for a mammogram outside the Indian context, and especially Indian woman, okay, so especially South Asian woman, the study shows that have to have, they used to have a firm, dense breast, as well as medium to large breast. So it's better to go for a mammogram along with sonogram, ultrasonogram. So when you combine both these things, we can overcome these challenges. Okay, so this is very important. So if you are going for Saudi Arabia, like you are living in Saudi Arabia and going for screening, you can ask them to do, can get the appointment of mammogram along with mammosonogram, that is ultrasonogram. It's all painless procedure, very easy procedure, and it can be done in minutes of time, and it will give a lot of advantage. Yes, Dr. Helen.
Another question is, can the self-examination be repeated if possible? I will answer. The self-examination has to be done from the age of 20 years every month. Okay, so I would suggest all of you, maybe if this is the first time you're listening to a breast cancer awareness program, then kindly, whenever suitable, because we said that you should do it 1 week after your periods so that it is not tender, I mean, it is not painful. And then I want you to do the examination for the first time. Please use a diary, write it down, which date you are doing. The next month, also try to repeat, and then you will start noticing for changes. So I want you to do this throughout your lifetime. You know, the very sad part about this breast cancer is that at the age of 60, 70 also we have seen cases, okay? So beyond a certain age, you know, your risk goes down, nothing like that. You have to do it as long as you are in good health, okay? Mm-hmm. And how often should a mammogram be done? Again, you need to start doing it from the age of 40 years, and it is prescribed annually every year. Okay, there is some change, some slight variations in American Cancer Association. They have said every 2 years once. Okay, so there are some variations, but most of them have said annually. So every year you need to do mammogram. Let me tell you, like this is Dr. Suban is my husband, so he always tells me, I have been trying to do this awareness for quite a long time. He used to always tell me that you have to practice what you preach, just like how the other breast cancer oncologist, remember we just saw her example. So each time when I talk about this, I always try to also look into myself, whether I am trying to follow all the practices. So once I crossed 40 years, I did my mammogram, and alhamdulillah, it came normal. I'm just telling you that it is important that all of us should do it. Okay, when something like this is available, we should not fear, and we should go ahead and do it. Okay, and another. Sorry,
doctor. Yes, the sister who asked to repeat the breast self-examination. I'm not sure whether she meant as in to repeat the lecture itself. So don't worry, we will inshallah, we will try to post a message on the WhatsApp group. Inshallah, we will post how to do this, the basic steps of a breast self-examination, so that you can save it with you and you can keep it with you, inshallah. So please stay on the WhatsApp group. We'll delete it probably after about 24 hours. So within then, inshallah, we will post a small summary of how to do the breast self-examination. Thank you, Doctor. Continue.
Yeah. Then another question, can the use of hormonal medicines for pregnancy cause breast cancer? Dr. Suban, would you like to answer this?
No, actually, nowadays we are not using any hormone therapy which stimulates the estrogen receptors. Okay, we are very aware, and no approval is given to any kind of such therapy. You can go ahead. Even oral contraceptive pills previously used to cause. Now, none of the are been studied, and they removed those kind of therapies. Okay, it's all cleared now. And regarding the self-breast examination, the duration of self-breast examination, you can easily remember as 20, 30, 40. So from the age of 20, it starts. So I think our Dr. Sherehan and Riham would have presented that 20, 30, 40, how to easily remember. So nowadays the concept is of be aware. Okay, so when you take a bath or anything, like rather than doing on a specific month and specific day in a month, be aware. That is the concept is being promoted. Okay. After that, there is a difference of opinion came. It's created more anxiety among in the females like that. So then they removed the concept of be aware. But if you are aware of these things, okay, it will definitely, if you put it into practice when you're bathing or when you're dressing up, okay, so definitely you will see some changes if you are noticing regularly, and you will see changes. Especially men play a major role in Muslim community, because female sees a change and tells to the husband. Unfortunately, husbands are very shy to talk about these things. Okay, so this is another disaster happens in our community. So we have to educate equally the husbands, okay, the men also, because most of the women tell their issues to the men. I don't know about Saudi context actually. In Indian context, this is the scenario. Unfortunately, men are very shy about talking these things, and so equal awareness should be given to men. This they all have to keep in our mind. So be aware. That's what very important. So if you have a knowledge, then apply this knowledge, act upon the knowledge. Okay. And if the most important thing, as Shreyan said, if you do mammogram regularly, forget about all the difference of opinion. Okay, that is not suitable for other countries. Difference of opinion, what we are discussing at the higher level, don't fall into those traps. That is for a North American context. Okay, don't get no get into those things. For other non-North American context, all this cancer screening is very important. As Shreyan said, okay, it will help us to identify in a very, very tiny stage. Okay, very, very tiny stage. So what is our benefit of it? We will remove only that part, and they will give some mild radiation and some therapy based on the receptor positivity. That's it. So no need of cosmetic correction, nothing. And you have a disease-free period for longer period. Okay, so no need to worry. That is the advantage of diagnosing it very early.
Okay,
Just
next
go ahead.
question I would like to put forward to you is that how long does it take to advance the cancer from stage 0 to stage 4? And there's another question, what causes breast cancer? Both for you.
Yeah, see, first let me address how long it will take from stage 0 to stage 4. Okay. See, first of all, you have to understand most of the cases in our community, as Dr. Helen said, it comes in stage 3 or stage 4, comes to the hospital and in Indian context. And Saudi context, we get the cases in stage 1, stage 2, okay, more. And stage 3, stage 4 is this when compared with Indian context. Now, the progression of stage 0 to stage 1, stage 2, stage 3, stage 4, okay, it is depends upon what type of tumor it is. Okay, what type of tumor it is. Actually, there is no any periodical framework. Okay, if you say it varies from each tumor to tumor, and also depends upon what kind of receptor positivity they have. Okay, what are the co-factors it is associated with. One thing I have to understand: stage 3, stage 4, all the stages we are doing to provide a prognostic factors. In other words, like a survival period. What is the survival period after treatment? So stage 4 survival period is less. Okay, so for example, 5 years survival period we calculate will be like 20 to 25% when the person is in stage 4, which means that 20 to 25% only chance of surviving in next 5 years. So even though we say 20 to 25% chance for surviving next 5 years, but to be frank, it's literally less than that. Okay, so that's what we are worried. Okay, so even the treatment, everything is not very cost. It's not uh, cost effective. It becomes very costly, and affordability should be there. A lot of many factors are there. So we cannot say exactly. So that's why histology of the tumor, that is histopathology, that is pathology, when they see the tumor in microscope, and that adds a very value to it. So then they classify the tumor and they do receptor analysis. Then they'll tell, okay, this is stage 1. So then they discuss with the treating physician, and then how fast this tumor can grow, that depends upon that. Okay, so we cannot give very straightforward answer to that. Even if you ask Google, somebody is telling, don't rely on that.
Okay.
What is the next question, Helen?
There was one, what causes breast cancer?
Yeah, it's a multifactorial cause actually. So it's not one hit hypothesis. Okay, so this causes breast cancer. It is multifactorial. Once you come to the point, there is increased receptor activity, hormonal activity happening in the breast, especially estrogenic activity, which is causing breast cells to divide fast in an uncontrolled manner. That's what's happening. So there are many factors, okay, which are all associated with the breast cancer. So all these factors can be modified if you follow the Islamic values. So, but Western people, they classified them into modified and unmodifiable risk factors. These are the causes. Okay, I think they would have discussed a lot of list of things. Other than that, there are strong association did in UK. They found in the research strong association with alcohol and the smoking. Okay, strong association with breast cancer. So apart from that, it is mainly lifestyle related. That's what they discussed. And frequent childbirth gives protection, and um, lactating gives protection. So how long, that all the period is estrogen free period. Okay, the breast is not stimulated to divide more. So if you have more estrogen free period, then you will become low risk status. So that's what very important to follow the Quran and Sunnah. It gives lot of protection for the woman.
Yes, there was a question asking whether breastfeeding mothers have to also do the breast self-examination every month.
See, actually, it's not needed because lactating women of that age group, okay, it's not really risk associated. Okay, so but depends upon another factors, whether their first degree relatives is having breast cancer and the breast cancer runs in their family. So which means that there is a chance for a certain kind of genetic mutation we call BRCA1 and BRCA2. So this mutation, if runs in the family, then we recommend, okay, so if there is any change happening in the breast, okay, so even the palpating and examination of that will be difficult, but even then they can do that kind of aware of these changes, okay, that helps them a lot. Okay, depends upon what risk category they are.
Okay. There is another question. I can read it out. My mother was diagnosed with third stage breast cancer 4 years ago. She's okay until now.
Sherehan, your voice is breaking.
Okay. I'm reading the question, doctor. My mother was diagnosed with third stage breast cancer 4 years ago, but she's okay now except for fatigue after the treatment. Are there high chances for her to be diagnosed with breast cancer again? Are there any specific precautions she must take to prevent from being diagnosed again? So she's asking about the recurrence of breast cancer.
So my mother was diagnosed with the third stage breast cancer 4 years ago, and she is alhamdulillah doing healthy and fine now, except how fatigued she is after the treatment. Are there high chances for her to be diagnosed with breast cancer again? Are there? See, actually, we have a clearance index. Okay, so they would have achieved a clearance index, that is tumor clearance index. Okay, then only they would have finished the treatment. Okay, so for example, if the tumor is very fast growing, okay, and when you give a treatment, okay, immediately the tumor will be cleared, okay, and again they will come back. Okay, the tumor is is very like a medium pace tumor. When you give a treatment, it will take long to clear, but actually it will not come back. So there are the clearance rate we calculate. So hopefully she will not get. Okay, there are many cases stage 3. Okay, they have been having without disease-free period of achieving 10 years, 12 years. Only thing is she has to be followed up. Okay, only thing is she has to be followed up. No need to worry of these things. Okay, so she has to be followed up. She can live the daily normal routine life. Okay, because of the treatment, okay, all these things she would have been fatigued. Okay, slowly she will come back, and we have to be very optimistic. She will do well. Okay, if you want more details, you can send your mother's diagnosis and other details. Then we can I can share with Sherehan and others. Okay, what are the things you can do more about it.
I just had one advice to the sister. So as you know that you will be under high risk, you need to do the screening regularly, and all the the sisters around. If you have if you have sisters, if your mother has sisters, all of them should do. They are under high risk and they should do screening well. Okay.
Now with the current treatment, the stage 3, because I think she has asking the follow-up question of what is the survival period. I think the stage 3 has now with recent advancement and treatment, actually the stage 3 is having a good survival period. Like it's not like almost like 75% survival period we have. So it's the and based on regular follow-up and regular treatment, okay, and she can have a very good normalcy life. Okay.
There's one more question. What is the survival period recurrence chance for stage 3 that has spread to the lymph nodes? How can recurrence chances be reduced to minimum when the patient is on 5 years hormonal therapy and finding it extremely difficult to maintain the ideal weight due to steroid?
Yeah. See, regarding steroid-related complications, it's a separate topic together. And then hormonal therapy-related complications, okay, we can discuss a lot. But regarding the maintaining the ideal weight and other things, okay, you can go for a lot of rehabilitation procedures, okay, so that helps you a lot. And regarding the recurrence chance to be reduced to minimum when the patient is on 5-year hormonal therapy. So actually, we are giving this therapy itself for to maintaining the tumors not to appear. Okay, so the challenge is continuing the therapy with achieving the normal immune mechanism and other functionalities is quite challenging. So it depends upon each individual. So tolerance level will be measured. According to that, they'll shift the doses of the therapy. Okay, and hopefully they will be doing well. Okay, by means of adjusting the dose. So regarding the steroid therapy, you have to have a regular follow-up because steroid therapy related complication will appear one day. Okay, for example, they will get other hormonal disorders. Okay, so that you have to be watchful. That's what we recommend them to have a frequent follow-up so that we identify it. So we adjust the doses of the drugs. So that will help them to maintain the normal day-to-day life.
Do you have any more questions from the sisters? If you want to speak or ask a question, you can raise your hands. We can unmute your mic and you can speak. I think, mashallah, we've covered all the questions.
Okay, Sherehan, and I
Okay.
think.
Okay, thank you, Dr. Suban, for your valuable time.
Okay, thank you, welcome. I think you guys are doing a great job. Okay, I hope you people continue this. Okay,
Okay.
and I wish all the participants so what they learn, they have to implement and act on it. So that's the most important thing. Okay, thank you guys. Okay, thanks for giving me this opportunity.
Thank you so much, Dr. Suban and Dr. Helen and Riham.
Yes, I just want to say thank the participants again. Thank you so much for being with us. And I hope you learnt a lot, and hope many of your doubts are cleared. Okay, just remember us all in dua, and lead a positive, healthy lifestyle. Jazakallah khairan. Do you want to say something, Sherehan?
Yes, sisters, please, we kindly request you to attempt the post-program survey, because this is not just for your benefit, but it's also for the benefit of the community, inshallah. If we can use information to better this program, inshallah. So please, I humbly request everyone to attempt the post-program survey as well. That will be posted on the WhatsApp group. And you can also ask your questions on the WhatsApp group. Inshallah, it will be opened for 1 hour for your comments and for your questions. So if you have any other questions, you can post it on the WhatsApp group, inshallah. And we will answer them. Within 24 hours, we will try our best, inshallah. So thank you everyone for attending.
I would like to end with a dua. Subhanakallah wa bihamdik, ashhadu la ilaha illa wa astaghfiruka wa atubu ilayk.